Good day, folks. Thank you so much for joining us today once again for another session. Today we have with us a second generation immigrant, Mahvash, who is now a doctor and professionally working in the field. So she will explain her journey here, and we will get to know a little bit about her. So let's get started. Thank you, Mahvash. So if you can get started by telling us a little bit about yourself first.
Hello everyone, my name is Mahvash Shere. I'm one of the second year residents in the obstetrics and gynecology program at Western University. I'm currently pursuing my residency and that's at Western. Before this, I did my medical school at Queen's University. I've had a bit of a non-traditional path to medicine. Prior to medical school, I did my undergrad and my PhD at University of Toronto. My undergrad was in biochemistry and pharmacology, and my PhD went on to be in clinical research and pharmaceutical sciences. And it was really during my PhD that I realized that I not only enjoyed working in clinical research, but also in this specific patient population, which was pregnant women. And I found that work really rewarding, and that's kind of what helped me recognize that medicine was what I truly wanted to pursue.
Interesting. So we talked about the fact that there's certain things that have to be done while you're going through high school. Can you relate a little bit about that experience?
Yeah, so I think the journey to medicine begins pretty early on. For me, even growing up, both my parents had backgrounds in the sciences, so the pursuit of science was something that was really encouraged in my household. I remember, even early on working on assignments with my mom and with my dad, and really learning about sort of the scientific approach to thinking, which was something that I really enjoyed. Going onwards to high school, I found that I was really involved in biological sciences and really enjoyed learning about human anatomy. Combined with that, I really enjoyed sort of helping the community in a way that was concrete and actionable. And medicine seemed like a really good fit and a pathway to be able to do both of those things. So that's kind of how that piece began. I understand you were asking a little bit about, recommendations in terms of what I'd recommend to other people pursuing a similar path. So early on in high school, I think it's important to keep an open mind and explore the breadth of your interests. I think high school is really too early to know if, there's a specific career path that you're driven towards, but I think it's important to explore the breadth of your strengths and interests. And really, at the beginning, it's all just about hard work and discipline. So ensuring you're motivated about pursuing your homework, completing your assignments in a timely fashion. Your grades, of course, are important in high school, and then extracurricular involvement. Because I think going through our school system, high school is the first spot or the first point at which we really discover how to combine schoolwork with a sort of extracurricular activities, and getting an idea of a balance in that sense is really important, and probably a reflection of how work will continue to look. Going forward from high school, in terms of the undergrad journey, what actually matters in terms of medicine applications include your GPA, so that's your grades in your courses, your MCAT score, so that's going to be an exam that you'll write probably after your second year or in your third year, as well as your involvement in extracurricular activities. And so for medical school specifically, that includes research, that includes community involvement and volunteer work, as well as sort of extracurricular activities where your passions are. So that could be sports, that could be volleyball, that could be chess, or wherever else your interests lie. But medical schools really want to see a well-rounded applicant who, as colleagues they would enjoy working with, who they can perceive as a future leader, and who they can see truly cares about, helping their community and helping future patients.
Yeah. One thing that is generally perceived in the community is that normally parents want their children to pursue medicine. What is your take on that?
Yeah, so I think, sometimes in our community, it's tough to figure out exactly who wants medicine, whether it's the family or the child. And I have to say, even in terms of my experience, I've run into classmates where a lot of the time, it is their families who wanted them to get here. And it's a disservice to them, because they end up being at a point where they don't realize, where they realize maybe this is not what I want to do with my life. Medicine is a long, hard road, and I think recognizing the amount of sacrifice it will take is really important. And I think learning that lesson early on is what actually allows you to be in the right mindset for it, and continue to be a good doctor and a good service provider to your future patients. For example, like we said, in Desi communities, a lot of the time it's associated with prestige. A lot of the times it's associated with this is the only career which will let you serve people, but that's actually not true. If you have interest in the sciences and, medical school isn't working out for you, whether it's because of grades, whether it's because of, you've had sort of, a non-traditional path or whatever reason, there are many other pathways that will actually take you to just as rewarding professions. So whether that's, being a physician assistant, whether that's being in pharmacy, whether that's being in nursing. And we currently live in an age where there are many other, allied health professions that work very closely and kind of involve the same scope of care. Perhaps they may not involve the same specialties, but there's actually a lot that can be done in related medical fields, and they may be viable career paths for people who sort of have similar interests but maybe don't want to pursue the same path as the formal traditional model of medicine.
Perfect. Thank you so much, Mahvash, for the insight. One thing, if we could request you, is that if there is anybody who wants to, who's in that stage of making the decision, I hope they can reach out to you.
Absolutely.
And they can, and you can advise them. One thing I don't know if you can guide or help in is for the new immigrants who move here with degrees abroad, from abroad. What is your take on that? How do you think that works out? What's your advice to them, if any?
Yeah, so do you mean sort of degrees in medicine, or
in
have they been practicing?
Yeah, so they've been practicing doctors outside and they moved to Canada. So the transition, and I know you're familiar with some people who have done the transition, but what would your advice be to those folks?
Right. So I'm not super sort of familiar with the entire process, but from what I've heard, the first few steps involve just clearing the LMCC licensing exams. So that's sort of step one, and I think that can be prepared as early on as on your move, towards your move to Canada. Beyond those exams, generally the pathway to being a practicing physician in Canada is actually doing some sort of residency credentialing, either repeating your residency or accumulating enough experience in a remote community. That, of course, is very challenging if you're a new immigrant and trying to immigrate to a place with supports. So going to a remote place is not always easy. If you don't fit into sort of that category, then the alternative is sort of going through another residency round. So typically, the family medicine residencies in Canada are 2 years, which would be for generalist practice, and then most of the specialist residency programs are 5 years. So after you clear your licensing exams, the expectation would be that you go through residency in order to actually be able to be a practicing physician here.
Perfect. Thank you so much, Mahvash, for your time today. And we'll stay in touch with you in the future.
Thank you.
Thank you.